Here we go. I am Dr. Isaac Mwangi, a pharmacy undergraduate student at Kenyatta University, Kenya, ready to showcase my motives and projects, video narration script, health and education empowerment project. This journey began with a hope, traveling to serve, learn, and empower communities through health and education. The Health and Education Empowerment Project, inspiring healthy minds and informed lives. Our journey was strengthened by Pioneer Medical Foundation, a great partner in our outreach work. Here in Meru, Kenya, we set up our medical camp, Ari, surrounded by calm nature and balsam, ready to make an impact. Preparing our tools and medicines, every item here means a life we can touch and a lesson we can learn. Here, I begin triage, checking a young child's temperature, the first step towards care and comfort. After examining this gentleman's blood pressure, I advised him to rest in the shade. His readings were higher. Early guidance saves lives. In the lab, I collected blood samples through the tube method, useful for precise testing and volume analysis. Here, using the pricking method, a quicker, less invasive sampling technique often used in field research. Sorting samples to test for blood groups and cell structures, key to understanding health patterns. Under the microscope, every drop of blood tells a story about life and the disease. On the right, dense clusters on the left, while blood cells, irregular in shape, with lobed nuclei typical of leukocytes. A team effort, together we made the day successful, driven by passion and service. As night fell, we wrapped up with gratitude, knowing the journey of impact continues. Now that samples are collected, what's next? Research always leads us to deeper questions. Back in the pathology lab, we analyzed human skeletal structures, linking our samples to real human anatomy. Our work doesn't end in lab. It extends to the community where unity builds resilience. Ready for emergencies from fainting to bleeding, where quick, basic care can save lives. Here, we helped a collapsed victim. Working with bystanders shows that community response matters. Triage, those first steps in assessing and prioritizing care before full diagnosis. Not every case needs deep triage. Sometimes quick wall care makes all the difference. Sterile toes, gentle care, preparing for wall dressing to promote healing safely. Applying pharmaceutical skills, dispensing with precision and responsibility. Our impact goes beyond the clinic. Through social media, we share knowledge across continents. Platforms like TikTok help us reach millions. Let's watch a short clip on the harmful effects of misuse of medications.
Did you know paracetamol overdose is a top cause of liver failure? Clinical manifestations normally include nausea and vomiting.
And that's the reality. Here's part of our awareness effort, a cancer campaign we ran in January. Let's listen in.
What are your general views on cervical cancer?
So, cervical cancer is a persistent infection caused by the human papilloma virus, normally transmitted via the sexual activities. And on this cervical cancer, the major other causes are apart from the human papilloma virus. We have also things to do with the smokings. We have regular. That's truly accurate based on current data. Now let's hear from the community. What do they think about cervical cancer?
So, what are some of the risk factors that may lead to one developing cervical cancer?
Yeah, one of them is human papillomavirus infection, or commonly known as HPV.
Other risk factors include smoking, long-term use of oral contraceptives.
Is a long-term use of oral contraceptives.
Have engaging in sexual activities at an early age, it predisposes you to infections such as HPV, which will lead to cervical cancer.
A risk of developing cervical cancer if they carry multiple preterm pregnancies.
Sio lazima wewe kila siku ya pili ya tatu ati lazima uproduce mtoto.
Congratulations, the community is now informed and empowered. And all this and more are what have been flowing from this very man. Beyond health, I have been on the forefront line of education advocacy, pushing for literacy and awareness across Africa. Here's one of our sessions on Pseudomonas aeruginosa, a bacteria now resistant to many antibiotics. Sometimes you may opt to use or not to use steroids to reduce inflammation steroids like the dexamethasones. You also use the PDLs. Wow, and that's really true. Many people stop treatment early, leading to dangerous resistance. When people understand the act wisely, awareness builds a sustainable, informed community. These forums and discussions reflect our ongoing efforts to inform, connect, and empower. And that's all for now. Thank you for watching. Stay tuned for more updates from the health and the education empowerment projects. Thank you. Bye bye.